So when we conclude the data from the Pinnacle 1 and also this more real world data, we can really realize that there's a very simplified workflow using the LithiX, and we'll see that throughout the next few clinical cases, which we will show you to you tonight. But I think the most important aspect are summarized here. So of course, imaging, if possibly, is always really good to be forming calcified lesions if it's feasible in your cath lab. We would suggest using a 2.0 balloon NC to try and confirm the passage of a balloon, and of course just to see if it perhaps you're able to delete the lesion with the NC balloon. Of course, if you're doing imaging and you see significant calcification where you want to use a calcium modification agent, and the catheter passes smoothly, then the LithiX should also pass without using an NC balloon. Very importantly, we want to go for 1-to-1 sizing. This is very important. Using imaging, of course, that is quite easy to perform, but 1-to-1 sizing is really important to ensure that we get into contact with the calcifications. Gradual inflation, 1 atmosphere per second, leaving the balloon up for 15, 20, 25 seconds if the patient tolerates it well, and then, of course, multiple inflations. Since these two studies, I think that LithiX has been used in about 1,000 patients worldwide, and I think the average number of inflations to crack these really concentric calcified lesions are about 6 or 7. So take our time, multiple long inflations, atmospheres between 5 to 6, up to 12. But remember, 12 atmospheres, it's a semi-compliant balloon, and your 3.0 LithiX, for example, will already be about 3.3 in size. And of course, step 4, optimizing the PCI with post-dilatation prior to stent implantation is very important.